Hello, my name's Anna. I'm going to be your nurse today. I'm going to perform a head to toe assessment on you.
Okay.
First, I perform hand hygiene, and I will assess the patient's mobility, posture, build for any deformities, dress, and grooming. I assess their skin color, facial expression, alertness, and eye contact. Assess speech, hearing, vision concerns. Do you have any speech, vision, or hearing concerns?
No.
I'll obtain her height and weight. I'll get her weight on the bed scale. And how tall are you?
5'8".
I'll check her distance vision and I'll take her vital signs. First, we'll start with the head and face. I'll inspect skin, eyes, ears, and skull. I'll inspect and palpate the scalp and hair. No bulges, her hair is evenly distributed, no dents, everything looks good. I will palpate the temporal mandibular joint. Can you open your mouth for me and shut? Thank you. I will palpate facial bones, frontal and maxillary sinuses. Everything looks good. Now I'll test her cranial nerves 7 and 5. Can you raise your eyebrows for me? And don't let me push them down. Thank you. Can you puff your cheeks out? Thank you. And can you clench your teeth for me? One more time. Thank you. Everything looks good. I'll palpate the lacrimal glands. Looks good. I'll test near vision. I'll assess her pupillary light response. Just look straight ahead for me. Everything's brisk. Her pupils are about 2 millimeters, so everything's good. I will assess for accommodation, check corneal light reflex. I'm just going to move my finger towards and away from you. Just follow my finger, okay? Looks good. I will assess for extraocular movements. Can you just follow my finger? Thank you. I'll assess her visual fields. Can you cover up your right eye for me? All right. How many fingers am I holding up?
2. 3.
Can you cover your left eye for me? How many fingers?
3. 2.
Thank you. I will test the red reflex as well. Next, we'll move on to ears. I'll evaluate her hearing, inspect her external auditory canals and tympanic membranes, and I perform Weber and Rhine tests. Next, we'll look at the nose. I inspect the nasal mucosa, sputum, and turbinates, and I'll test her sense of smell. For the mouth and pharynx, I will look at her lips, buccal mucosa, teeth, gums, and tongue. Can you smile for me? Thank you. Can you open and say ah? Thank you. Everything looks good. No redness. No swelling. Next, I will check her taste response and I'll check her gag reflex. For her neck, I will test range of motion. Can you look to your right as far as you can for me? Can you look to your left? And straight back as far as you can. Now put your chin to your chest. Thank you. Range of motion's good there. I'll palpate her carotid arteries, trachea, and thyroid gland. Everything seems good. No swelling on the thyroid. For her, and I'll auscultate the carotid arteries. Everything sounds good. Auscultate the thyroid gland as well. For upper extremities, we will inspect muscle mass and strength. Can you squeeze my fingers for me as hard as you can? Thank you. They're equal, good. We're going to check joint range of motion. Can you lift your left hand as high as you can for me? Can you do the same with your right? Thank you. Good range of motion. I will assess her pulses. We'll do radial. Good, this one. brachial. Strong pulses, everything's good there. I will palpate the epitrocular nodes as well. Any pins and needles or anything?
Nope.
Okay. Now we'll move on to her back. Can you sit up a little bit for me? Thank you. I'll check the skin, shape, symmetry, and muscle development. I'll inspect and palpate the spine and scapula. So everything looks straight and in line. No protrusions, everything feels good. I will percuss the spine. Everything feels good. Next, I will percuss the costrovertebral angle. Seems good. Next, we're going to move on to the lungs. I'll note for respiratory characteristics. I don't hear her wheezing or anything like that. Are you having any trouble breathing?
No.
Okay. I'll check thoracic expansion, palpate for tactile fremitus, percuss for resonance, percuss for diaphragmatic excursion, and I'll auscultate breath sounds in the Z pattern. Take a deep breath for me, and out. Deep breath, and out. Deep breath, out. Deep breath, out. Deep breath. One more. Everything sounds clear. She's not diminished. So next we're going to do chest, breast, and precordium. We're going to inspect skin, muscles, and respirations. I'll palpate her chest wall, palpate the precordium, located the point of maximal impulse. I palpate her lymph nodes, percuss for resonance, auscultate heart sounds. Can you lay back down for me? I'm just going to listen to your heart real quick. Everything sounds good. I don't hear any adventitious sounds. There's good S1 and S2, no murmurs. Everything seems good. So now we will inspect breast, palpate breast in 4 seated positions, inspect the precordium, examine for jugular vein distension. I don't see any distension, so that's good. Palpate each breast with patient's arm above head. I'll palpate her chest wall, and I'll auscultate this heart again for all the different valves. So I'm looking at aortic, pulmonic, tricuspid, and mitral. And then for mitral, I'll have her turn to her left side a little bit. You could. Thank you. Sorry. I'll just listen for her mitral. And sounds good. No murmurs. Next, we're going to move on to the abdomen. I'll auscultate